Hello friends, hope your preparation is going well. We will try to discuss important topics in the form of question which has been recently asked. So we start with January 23 questions. First question is a very important topic. Medical cause of mental illness or organic mental disorder. Medical cause of mental illness or other name organic mental disorder according to ICD-10, but the new name is neurocognitive disorder. So cognitive disorders include dementia, delirium. Every exam you will find question on delirium. Whenever a long clinical question is given, let me give you the history, how questions are asked. There is a patient came to OPD, yes, after fracture of hip, okay, or present in emergency after fracture of hip, was operated. After operation, shifted to ICU. In ICU, he is very aggressive. He is behaving weirdly. He is having hallucination. He is having delusion. So whenever you will hear the word hallucination and delusion, I point out, if you hear the word delusion and hallucination, immediately you will think of psychosis. Okay, acute psychosis. But remember, if hallucination and delusion is there and they add one more word, that there is altered sensorium or clouding of consciousness, the answer would become delirium. So for the time being, in long clinical question, you will remember if acute history is there, what I said, acute history is there for few days and patient has loss of consciousness, altered sensorium, confusional state. What I said, confusional state. These three words you will remember. Whenever you find these three words, yes, without second thought, acute, answer would be delirium. And in delirium, hallucination would be usually visual hallucination. Every exam, same question, little bit modification. They will give all the same thing and they will tell that patient is taking alcohol for last 20 years. Means patient presented in emergency after his fracture, was operated, shifted to ICU, aggressive behavior, abusing everybody, delusion, hallucination, altered consciousness, history of alcohol. The answer would change to delirium tremens. Delirium tremens. So same question, if history of alcohol, delirium tremens. So these are organic mental disorder. Dementia is organic mental disorder. Now, which of the following suggestive of medical cause of means organic mental disorder? I just told you loss of consciousness, suggestive of delirium. Acute onset, suggestive of delirium. Elderly age, I told you dementia is also organic mental disorder. So dementia karin, old age. So elderly age, you will remember. Visual hallucination, suggestive of organicity. So auditory hallucination is the answer. So I told you in this way, the reason is that you will remember with the help of delirium and dementia. Okay, with the help of delirium and dementia, all the points suggestive of organicity. Clear? Now perseveration. What is perseveration? Question is asked. There is a patient, I ask, what is your name? Patient says, my name is Mahesh. I ask, where do you live? My name is Mahesh. What is your father's name? My name is Mahesh. Means same thought is continued beyond the point of relevance, that is perseveration. And whenever perseveration is there, you will think of organicity first. You will rule out organicity. If organicity is not there, then psychiatric disorder. Labile mood, mnemonic for labile mood is MDH. M for mania, D for dementia, H for histrionic personality. D for dementia, yes, dementia is organic mental disorder or neurocognitive disorder or medical cause or mental disorder due to medical illness. Got the point? So answer is auditory hallucination. Multiple questions solved by this. Second question, lithium. Every time again, question is being asked. Lithium, before solving the question, lithium is having very narrow therapeutic index, means if concentration of lithium is 0.8 to 1.2 milliequivalent per liter, then it is therapeutic dose. But if, or therapeutic concentration, if more than 1.5 milliequivalent per liter, then toxicity. So such a narrow therapeutic index, that's why whenever we start lithium, we do monitor. Suppose I started lithium today, I will ask patient to come on 5th day after 5 days to check lithium level. So we check lithium level after how many days of starting lithium? Question. Yes, lithium level is checked after 5 days of starting lithium. Recently asked question. Sample should be taken after 12 hours of last dose. Means suppose patient took last dose in the night at 9 p.m. You will take the sample at 9 a.m. Means 12 hours after last dose. Lithium is excreted by kidney? Question. So, whenever you start lithium, always do kidney function test. This is called pre-lithium workup. What I said, pre-lithium workup, because if kidney is not functioning, lithium will not be excreted and lithium toxicity may be there. If a patient is taking lithium, he may have side effect, diabetes insipidus, hypothyroidism, frequently asked question, sometimes hypothyroidism, commonly hypothyroidism, fine tremors. How you check fine tremors? You ask the patient to stretch hand. Yes, you put paper, there would be, that is fine tremors. No need to worry. Fine tremors, we give beta blocker. We give beta blockers. Now, if patient is having toxicity, then coarse tremors. And in coarse tremor, you will examine the patient. There would be hyperreflexia, coma, maybe death. Okay, so these are the important point of lithium. And now, in toxicity, you will do dialysis. If such a severe symptoms are there, you will do dialysis. Why dialysis? You all know the alternative of kidney. Yes, lithium is excreted by kidney. So alternative of kidney is. So these are question. Now, 27-year-old female having bipolar disorder was on lithium. Which of the following statement is incorrect? Lithium is avoided in pregnancy due to its teratogenic effect. This is true statement because it causes Epstein anomaly. Question. Lithium decreases thyroid function. There is hypothyroidism. You all know hypothyroidism. Good. Yes. Thiazide decrease the clearance of lithium, so chances of toxicity increases. Okay. Decrease clearance lithium. This is true statement. Hemodialysis is not useful. I just told you it is useful. Dialysis is done in severe toxicity. So this is the answer. Next question, on mental status examination, patient is asked to subtract 7 from 100. Yes, 100 minus 7. Serial subtraction test. Serial subtraction test is done for concentration. Attention means to focus. If I ask you, may I have your attention please, you focus, means that is attention. If you continue, watch the lecture with concentration, then I will say yes, or sustain attention is called concentration. That would be concentration. Means to maintain focus is concentration. Okay. To check attention, no, it is not recorded lecture here. Okay. Yes. Yes, answer is not C, DK. Here we should interact definitely. Sorry for that, I could not appreciate your answers. Attention, to check attention, we have digit span test. Digit span test. Yes, digit forward, digit forward. For concentration, serial subtraction test. Many time questions are asked that serial subtraction test is also used for working memory question. Digit span test is also used for immediate memory. Immediate. Okay. Orientation, we simply ask orientation by asking what is the time, what is the place, who am I. Yes, patient says you are policeman, means he is not oriented to time, place, person. Yes, so simply orientation we can check by asking a simple question. Confusion, yes, I told you that disorientation, yes, altered sensorium, clouding of consciousness, confusion state, that is delirium. And to check delirium, we have confusional assessment method. Confusional or confusion assessment method. Okay, CAM. This question has been asked in NEET. So in this, 100 minus 7 is done for concentration. The answer is B. What is the common effect of cannabis? Yes, cannabis, marijuana intake, very popular, most common abused drug in India. Yes, illegal drug and worldwide. What is the reason? You know, it's having very mild dependence or withdrawal symptom. Let me describe cannabis related disorders. Sometimes when you take cannabis, you will feel decreased appreciation of time, state of dreaminess, depersonalization. So in this question, answer is C, no doubt. What about the other option? I will discuss one by one. For before that, you will discuss cannabis related psychotic disorder, hemp insanity. Many times you will find you took cannabis and you went to psychosis, hallucination. And it is called cannabis induced. But no need to worry. It will be resolved within 1 month. Yes, the diagnostic criteria, if a substance causes psychosis and if substance is stopped, these psychotic symptoms will resolve within 1 month. Flashback phenomena, you took cannabis. You are, yes, DK, answer is C, correct? Yes, you took cannabis. Now you are not taking, after few days, you are experiencing the same pleasure. That is flashback phenomena. A motivation syndrome, if you are using cannabis, now you have no motive in your life. Running amok, after taking cannabis, you become so aggressive, hitting everybody. Whosoever coming in the path, yes, it may be your friend, your relative, so that is called run amok. Reflex hallucinations are commonly seen with cannabis and LSD. Bad trip. Yes, you thought that we should enjoy alcohol and cannabis, but you took cannabis and you started palpitation, breathlessness, panic symptoms. That is bad trip. Panic symptoms, bad trip. So they try to confuse you. Bad trip, panic symptom, anxiety symptoms. This is not so frequent. This is not anxiety. That is bad trip. Depression, sometimes you may confuse with amotivation syndrome. Physical dependence is very mild. Okay, means not common. Previously we used to say cannabis has no physical dependence. Now we started saying little bit physical dependence is there. Yes, these depression or anxiety symptoms may be seen in withdrawal with not use. Okay, point out these important question. A motivation syndrome question, run amok question has been asked, reflex hallucination, cannabis and LSD. Okay, bad trip, I just told you mild withdrawal symptom. Previously we used to say no. Yes, dear, you know that cannabis is very popular in medicos even now, in spite of knowing that it can cause these psychotic features. The reason is that they are not so common and dependence is not there. If you take opioid, if you are taking opioid, you become addicted, means physical dependence. If you are unable to procure opioid, you will have severe withdrawal symptoms. But in cannabis, withdrawal symptoms are mild. That's why it become popular. Okay. And that's the reason it is most common illegal drug abused in India and worldwide, and even in medicos also. Okay, but never ever try, because I just told you that it can cause cannabis induced psychosis. But no need to worry, it will be resolved within, yes, how much time? DK, please tell. I just told you. Yes, after how much time it will be resolved? 1 month, if you stop taking cannabis or substance. Typical clinical question. 45-year-old person complained that aliens are communicating with him. They are sending electromagnetic radiation to his brain. Alien are asking him to kill his distant relative. This is command hallucination. They are commanding the patient, kill your relative. Command hallucination. Command hallucination. Okay. Now, these symptoms for last how many years? 20 years. For, yes, good evening, Bharat. Last 20 years. Yes, the patient does not work on farm, stop going to social function. These are negative symptoms. What I said? Negative symptoms. So in this, negative symptom is there and hallucination there for 20 years. And you know the concept. If out of these 5, means delusion, hallucination, formal thought disorder, negative symptom, catatonic behavior, out of these 5, 2 symptoms are there or more than 2 symptoms for 6 months, the diagnosis is. Got the point? So answer correct, schizophrenia. Yes, schizophrenia. In the same question, yes, if I say these symptoms are only, yes, you will give me answer. These symptoms are only for 5 months. Yes, what is the diagnosis? Can you tell me? Schizophreniform. Schizophreniform disorder. F. Brief psychotic disorder. Brief psychotic disorder. Yes. What would be the answer? Yes, schizophreniform disorder. Yes, if only 5 months means these 2 or more than symptom from 1 month to 6 months, then schizophreniform disorder. Okay. If less than 1 month, then the diagnosis would be brief psychotic. So remember this point, duration is very, very important. Clinical questions are asked. Many times we think that, okay, 2 symptoms, typical question, answer is schizophrenia. But no, if duration is 5 months, the diagnosis would be schizophreniform disorder. If duration is less than 1 month, the answer would be brief psychotic disorder. Very good, Bharat. Okay. Yes. Now, next question, we can move to next question. Yes. A 35-year-old man was taking medication for depression. Of the antidepressants are having a sexual side effect. You all know SSRI, escitalopram is SSRI, and it is very notorious to cause sexual dysfunction. In fact, all these 3 cause sexual dysfunction. So we are left with only few antidepressants having no sexual side effect. Those are bupropion, no sexual side effect. INICT recently asked question, another antidepressant having no sexual side effect is mirtazapine. जप रहा है वो भगवान का नाम, अब कोई सेक्सुअल साइड इफेक्ट नहीं होगा. यस, तो मिट्राजिपीन नो सेक्सुअल साइड इफेक्ट, बुप्रोपियोन यस नो सेक्सुअल साइड इफेक्ट. June 2022, yes, lithium. I told you lithium is very important. In last 3-4 years, you will find every exam is having question on lithium in different ways. Okay, lithium cause, yes, Epstein anomaly. Epstein, just discussed. Yes. Okay. Very good, Bharat. Yes, you know, this question was asked. Very simple question. You can mark the answer very easily. That is trichobazor. Sometimes patient is having trichotillomania. Trichotillomania means pulling hair again and again, again and again. These patients sometimes eat trichophasia. Phasia means eat. And when eat, this cause intestinal obstruction. Yes, trichobazor. Okay. Yes, trichobazor. Okay. So this patient was treated by surgeon. Definitely he will send the patient to psychiatrist because patient may be having trichotillomania. Many times this question is being asked, what is the reason? Because this is recent change in the classification. ICD-10 said that trichotillomania is impulse control disorder. Impulse control disorder. But ICD-11 and DSM-5 said this is OCRD, obsessive compulsive and disorder. Recently asked question in INICT that which of the following disorder has been classified recently in ICD-11 in OCRD, and the answer was trichotillomania. So this is potential question. Again, can be repeated. Yes, simple question. In this abstain anomaly, quite common question. Chronic smoker want to quit smoking. Yes, you know, remember two drugs. First is varenicline. Varenicline is alpha 4 beta 2 partial agonist. Partial agonist. But it has side effect of suicidal ideation. Suicidal. Yes. This is the difference between Frigoli and its opposite. Okay, I will tell you. Frigoli. Okay. Suicidal ideation. Okay. This question has been asked. Bupropion is NDRI, norepinephrine dopamine reuptake inhibitor. Yes, very good. You have given the correct answer. Yes, NDRI, bupropion, norepinephrine dopamine reuptake inhibitor. Both are effective. But yes, varenicline is more effective than bupropion. Yes, if one to choose, better answer would be this. But if both options are given, both answer A. The question has been asked to select the best, then answer would be C. Okay, but both are used. This question, all these questions are recall question. There may be little bit change and the answer would be changed. Let me tell you this question. 39-year-old man reported that he washes his hand 15 to 20 times a day, to the point that it taking a toll on his workplace performance. He says that this is due to repetitive thoughts that his hands are contaminated with dirt. Yes, yes, eating disorder I will discuss. Rigoli, yes, I have capped the question also. Okay, contaminated with dirt. So if you see this question, immediately you will say contamination of hand, washing hand again and again, OCD, without second thought. But in the same question, that repeating thoughts are being inserted in my mind. In the same question, if I say, yes, they add that these thoughts are being inserted in my mind, means this would become thought insertion. Thought insertion. And then you will think of schizophrenia. In this question, answer is definitely OCD. But in the same question, if I say that they said they joined one more statement, these thoughts are being inserted in my mind, thought insertion, Snyderian first rank symptom suggestive of schizophrenia. Okay. Now, let me tell you Frigoli syndrome, Frigoli and Capgras. So how to remember Frigoli, Capgras? You will remember by the example. There is a lady in ward. She says that her husband is not her husband. Her husband came to the ward. She started abusing, beating the husband, saying, "You are not my husband, you are somebody else, who is looking just like my husband, talking just like my husband, walking just like my husband, everything is just like my husband, but you are not, because you are wearing cap, mnemonic cap, you are wearing cap." So the lady said that my husband never wore cap, you can't be my husband, that is cap grasping. Yes, free goalie syndrome, how you will remember? With the help of example. Again I am saying, a person says, "Dr. Saab, you know that the beggar sitting outside my flat is not, he is my boss. He has changed his physical appearance just like a beggar." Okay, he changed his physical appearance just like a beggar. Yesterday I went to the station, he became policeman. Yes, when I came out and went to post office, he became postman. His physical appearance, and he can take multiple physical appearance just like he is changing the mask. So sometimes you will find free goalie, mnemonic for free goalie is beggar takes everything free, और गोली दे रहा है, different shape change, physical appearance change कर रहा है, he is changing his physical appearance just like he is changing the mask. Sometimes you will find that two masks are there, and they will show you image based question. Okay, clear? Eating disorder, in the last I have put one question, recently asked question, so don't worry. This question again, very simple question. I ask the patient, "What is your name?" Patient says, "What is your name?" "Where do you live?" Patient says, "Where do you live?" You must have played copycat with your girlfriend. Okay, yes, so that is copycat type play, but that is not a real game of boyfriend girlfriend. This is catatonia. That is echolalia, echo of language. Echo of lalia means language. Yes, means patient presented in ward when asked, "What is your name?" repeat the same sentence back to you. This phenomena is echolalia. Okay, seen in catatonia. What is echopraxia? Praxia means motor movement. Motor movement. If I do like this, patient also do like this, I would be so angry and put the patient on ECT. Okay, no, actually this patient is catatonia. Yes, echopraxia, echolalia, commonly seen in catatonia, and treatment of choice of catatonia is ECT, electroconvulsive therapy. Current लगा देंगे. Okay, got the point? Yes, Bharat, correct answer D. Yes, DK, correct answer D. Perseveration I have told you. So remember the difference. Echolalia, what is your name? What is your name? Where do you live? Where do you live? Perseveration, what is your name? My name is Mahesh. Where do you live? My name is Mahesh. Got the point? Posturing, maintenance of abnormal posture for long time, again seen in catatonia. And I just told you, perseveration signifies organicity, organic mental disorder or medical cause of mental illness. Got the point? Now, NEET PG questions. A patient presented in emergency department with symptom of respiratory depression was suspected to have overdose of opioid. Opioid overdose clinical triad is pinpoint pupil. Pinpoint. There would be respiratory depression, coma, may lead to death. Respiratory depression is most common cause of death. Question has been asked. So in this question has been asked, what is the initial management? Very good. Answer is A. Bharat, DK, you have given the correct answer. Yes, initial management. If initial management they ask, then secure airway. What is the drug of choice? Then IV naloxone. This is short acting opioid antagonist. Okay, so remember this point. If they ask initial secure airway, drug of choice, IV naloxone, opioid overdose. Next question. This question has been asked so many times in different ways. Just like, first of all, let me solve this question. TCA. In tricyclic antidepressant poisoning, if QR complex is more than 100 millisecond, the yes, immediately IV sodium bicarbonate. So showed wide QRS complex. So definitely treatment would be antidote is sodium bicarbonate. So why we are so much concerned about the TCA toxicity? TCA is antidepressant, and suppose a depressive patient is there, depression is there. We started with TCA. Patient is having very severe depression. What I said? Very severe depression, no energy. Severe depression, no energy. Suicidal thought. Now this patient is having no energy, want to commit suicide, then who will go to market, who will buy rope, who will hang himself? Not committing suicide. You started antidepressant, although we usually start with SSRI having least side effect. Okay. But suppose you started TCA, yes, patient is improving, energy is improved. Now, suicidal ideation is still present. Now you will discharge the patient will go to the market, will buy rope, will hang himself, will commit suicide. This is paradoxical suicide. This is paradoxical suicide. Means suicide in recovery phase. Suicide recovery phase. 2-3 time question has been asked. One question was that a patient is admitted with severe depression. Now you want to discharge the patient. What is your concern? Option A, cardiac toxicity of TCA. Option B, paradoxical suicide. The catching point was that we do cardiac monitoring of TCA only when we increase the dose initially and when we increase the dose. So when you are discharging the patient, at that time you are not concerned with the toxic effect or cardiac toxicity of TCA. You are concerned with paradoxical suicide. Got the point? Thanks, Dr. Sonu. This question is being asked again and again. Okay, I have taken these questions and trust me, all these questions or topics are being asked again and again. So you can't afford to forget these concepts. So 5 days normal vaginal delivery, a woman brought to casualty by her husband. She reports she has mild tearfulness. You can easily tell the answer. Please give answer. History of loss of appetite, difficulty in sleeping, feeling low, general physical examination, everything is normal. Yes, postpartum blue or baby blue. Okay. Yes, this catching point. Times question they will try to confuse you. When postpartum blues are there, this is mild symptoms of depression. Just like in this question, you can see mild tearfulness, loss of appetite, difficulty in sleep, feeling little bit low. Yes, they are not mentioning the severe symptoms. Severe symptoms, what does it mean? Severe symptoms just like anhedonia, suicidal thought, thoughts of harm to baby, guilt. Yes, these are, if these things are given, these points are given, immediately think of postpartum depression. In this question again, 5 days, you know, depression, to make the diagnosis of depression at least 14 days symptoms should be there. So this postpartum blues start within 3 to 5 days and resolves in days to weeks. Okay, and no need to worry. In this only thing you do, support the mother. Okay, no treatment but antidepressant for postpartum depression. If you find mild things, short duration, postpartum blues. If suicidal thought, anhedonia, harm to baby, thoughts of harm to baby, guilt, then think of postpartum depression, and their duration would be up to 3 months. Okay. Postpartum anxiety, no such entity. Postpartum psychosis, it's self-told. Yes. Hi Ansh. Thank you, dear. Postpartum psychosis, yes. Psychosis, delusion and hallucination. Delusion and hallucination you can easily remember. Okay. So in this, delusion would be related to baby, that I have not given birth to the baby. Not given birth. Or I have given the birth to dead baby, or my baby I have born that is demon. So these thoughts would be there, and these are at the level of delusion. Delusion, you know, false, firm, unshakable belief. And if unshakable belief is there, yes, they may harm child. So we should separate the baby from the mother. Okay, you will keep in mind. Now, next question. Yes, eating disorder. Eating disorder, a 60-year-old female was referred for irresistible urge to eat or craving followed by episode of self-induced vomiting. The patient is also on appetite suppressants. What is the most likely diagnosis? When this question was asked, at that time, little bit controversy is started, because this appetite suppressants. So don't get confused by appetite suppressant. It may be used by anorexia nervosa patient or bulimia nervosa. Okay. I tell you a simple way to solve question. Okay. Anorexia nervosa. Anorexia nervosa, the first thing is body image disturbance. Body, yes, answer is bulimia nervosa. Very good. Answer is, you know. Now I tell you how you will approach the question on, yes, yes, eating disorder. Anorexia nervosa, body image disturbance. What is body image disturbance? Suppose this is a girl having perfect shape, figure. When she looks at the mirror, she finds herself to be fat. According to this girl, the normal figure is this. I have taken deliberately this model BMI less than 18.5. Okay? According to ICD. According to ICD-10, her body mass index BMI was less than 17.5. So according to this girl, this is the normal figure of a girl. Okay, perfect figure. Okay. Now she want to achieve. To achieve this figure means to achieve BMI less than 18.5 according to ICD-11, she can use two methods. One, restriction of diet. Restriction of diet means she is not taking diet. When she is not taking diet, definitely weight would be decreased, BMI would go less than 18.5 and starvation symptoms would be there. So restriction of diet, we will say anorexia nervosa restrictive type. Anorexia nervosa restrictive type. Yes, type. Few patients of anorexia nervosa occasionally take large amount of food in a short time. That is called binge eating. What I said, binge eating. Binge eating word I write here, binge eating. Means eating large amount of food in a short time, just like Motu Patlu you must have seen, they eat. Okay, that is binge eating. Okay, जिसे कहते हैं ठूसना. Means few patient of anorexia nervosa will do binge eating. After that, they will induce vomiting, use laxative. They will take, they may take hypergymnasia. They may do to avoid the weight gain. Means purging. So you will say anorexia nervosa may be restrictive type or binge eating purging type. So binge eating and purging may be present in anorexia nervosa and bulimia nervosa. I write here bulimia nervosa. So in bulimia nervosa, there is binge eating and purging, no restriction of food. They take large amount of food in a short period, and when they do repeatedly purging, yes, acid will come in the mouth, will cause dental caries. When they induce vomiting, every time incisor strike on the knuckle, there would be lesion on the knuckle. And this scar is called Russell sign. Callus on knuckle or scar on knuckle, Russell sign. जैसे रस्सी से घिस के साइन हो जाता है ना. Infection of parotid gland, parotitis. So bulimia nervosa, binge eating and purging. Yes, I am going to conclude. Before that, yes, binge eating disorder. One more disorder, binge eating disorder. Most common eating disorder. Yes, means they take large amount of food in a short time. They do binge eating but don't do purging. Yes, we usually do. Yes, aren't they? And definitely they would be overweight. They would be over. In bulimia nervosa, weight would be normal or near normal. In anorexia nervosa, weight would be less. This is the catching point. Now I draw a flow chart. Okay. If question is asked on eating disorder, if patient is taking less amount of food, less amount of food. Yes, I am telling you. Yes, less amount of food. Yes, means restriction the diet and BMI is less than 18.5 according to ICD-11, anorexia nervosa, restrictive type. If binge eating is there, no purging, then binge eating disorder, most common type of eating disorder. If purging is there, purging is present, then you will check for BMI. BMI less than 18.5, anorexia nervosa. If more than 18.5, bulimia nervosa. Now, if they don't mention anything about the weight, just like in this question, they don't mention anything about the weight. According at that time, recall time, few students told that BMI was given. Okay, if they don't give BMI, don't comment on BMI, then you will think of bulimia nervosa. If they don't mention anything and they simply say Russell sign, it is more common with bulimia nervosa. Okay, so if binge eating purging is there, first answer which will come in your mind should be bulimia nervosa. If they want to differentiate it with anorexia nervosa, they would give comment just like in anorexia nervosa, there is body image disturbance. There is BMI less than 18.5. Okay, so you can solve questions by this. Now, okay, dear DK. Now, on 4th June, on our app, test would be live. Major mock test for FMGE. Yes, who is going to appear in this FMGE July 23 must attempt this exam. These questions are planned in such a way or put in such a way they cover all the important topics which has been recently asked. And the best part of this is after the exam, yes, when you will complete this exam, there would be live discussion of each and every question with our faculties. So 4:30 p.m. onward, you can see live discussion. So it would be very important for a preparation. It will boost your preparation like anything. So connect with this. Okay. So what is the method? Link is given in the description below. Yes, login at the app and attempt this question, this paper. After that, attend the live session. Best of luck. Thank you.